everyone, welcome at our presentation. This is Cathy. She is a 16-year-old girl who has recently been losing a lot of weight. After breaking up with her boyfriend because he was in love with her best friend, she tried to talk with her family, but she felt misunderstood. She started focusing on her studies and lost her appetite. Because of this, she started losing weight, after which people started to compliment her new appearance. Then she started focusing on her calorie intake and she began under-eating. People around her commented that she started to look too thin and that they were worried about her. However, she sees this as praise. We have talked with the client to diagnose her. As the client was losing weight quickly, we assessed the criteria for anorexia nervosa. The first criterion is a significantly reduced calorie intake relative to the requirements of the body, leading to a considerably low body weight. We asked her what a typical day of eating looks like for her. She told us that ideally, she eats a piece of fruit and a salad. This means that she meets the criterion, as she has a significantly reduced calorie intake, which makes her lose weight. The second criterion is an intense fear of gaining weight or becoming fat. In our talk, the client told us that she has nightmares about gaining half a kilogram, which shows that she has indeed a fear of gaining weight. Lastly, the third criterion is a disruption in the way that the patient evaluates their body or shape, increasing under influence of body weight or shape on self-evaluation. The client told us that she thinks others are praising her when they tell her that she looks thin. Furthermore, she perceives herself as fat and tells us that she would like to lose 1 more kilogram. She therefore meets the third criterion. And as the client purges sometimes when her mother makes her eat more than she wants, she can be diagnosed with the purging type of anorexia nervosa. The client also has some strengths that came forward in the talk with her and the questionnaires that she took. These are love of learning, appreciation of beauty and excellence, and creativity. If possible, some of these strengths would be used in her treatment. For Cathy, mainly creativity was included in her plan.
3 goals were formulated in order to treat Cathy successfully. These are: first, at the start of the treatment, the client will start the treatment by consuming 1,500 calories the first day. The calorie intake will increase with 50 calories per day until she reaches 2,550 calories per day after 21 days. Then, when reaching the goal of 60 kilograms, the calorie intake will be reduced to the recommended 2,300 calories per day. The second goal is, in the course of 6 months, the client will have a more positive perception of her body image and will have less self-reported negative thoughts and as a result of eating. The third goal is, in 8 weeks, the client has reduced her exercising time to 1 hour per day and found a new hobby or activity based on her strength, love of learning, creativity, and appreciation of beauty and excellence, that she executes instead and that shifts her focus away from food and body shape. With these goals in mind, interventions were chosen to later include in the treatment plan.
To help Cathy to overcome her anorexia nervosa, 2 approaches are used. The clinical approach aims at treating the symptoms of the disorder. The positive approach helps her to concentrate more on her strengths and see herself in a better way to increase her general mental well-being. This can also help to prevent future relapses. For the clinical approach, the most effective therapy for anorexia nervosa is family-based therapy. This therapy is based on the family systems theory, which states that the mental issues of the sufferer are the results of dysfunctional family that reinforces the development of an eating disorder. Therefore, family-based therapy aims at solving the problem within a family, developing strengths, and working on the relationships between family members. The therapy consists of 3 phases. In the first phase, the parents take full control of the meal plan. By doing this, they get control of the eating patterns of their daughter, which helps to prevent purging behavior. In the second phase, Cathy has to plan meals together with her parents. This helps her to get a more healthy relationship with food again. The last phase involves the client finding a healthy independence which fits her current age. The focus will be shifted from creating eating habits, which has now been established, to creating a healthy body and self-image. During this phase, the client and her parents have to determine what the client wants and needs for her development towards a healthy body and self-image. Therefore, family-based therapy helps to implement the first goal of weight gain. For the positive approach, there is a 6-session treatment which focuses on reflecting the social-cultural pressures of weight control, increasing self-esteem, coping skills, developing an internal locus of control, and education about healthy weight. Moreover, some positive therapies are chosen based on the client's strengths. Since Cathy likes drawing and can be described as creative arts therapy is included in an intervention. CAT includes drawing and painting to express emotions that cannot be expressed verbally. Therefore, creative arts therapy helps to reach the third goal, to find a new hobby or activity which Cathy can perform instead of excessive exercising. If she enjoys painting and drawing, she can spend her time doing these activities and decreasing the time currently spent exercising. Moreover, the therapy gives Cathy the feeling of control. Furthermore, there is dance or movement therapy, which has the subtype of body image therapy. In body image therapy, the patient has to stand in front of a mirror and draw what she sees. The drawing is then compared to a real and more positive and realistic body image. Therefore, body image therapy helps to fulfill the second goal, that Cathy gains a more positive perception of her body.
In order to achieve the goals that have been described earlier, a treatment plan has been set up. In this plan, both interventions have been combined and altered to Cathy's needs. In Figure 1, you can find the plan for the first goal, which is about Cathy's eating schedule and calorie intake. By including family-based therapy of the clinical approach, Cathy will be able to follow a doable eating plan in which she will gain enough weight for an acceptable BMI, with a weight of 60 kilograms. This treatment plan will immediately start since her weight is on a critical level, and therefore it is important to get her to a healthy BMI as quickly as possible. However, it is not safe to do it too quickly, which is why the treatment plan is stressed over 32 weeks, in which small steps of calorie intake are introduced. In Figure 2, an overview can be found of the treatment plan for achieving the second goal about Cathy's body image and her relationship with food. By again resorting to family-based therapy of the clinical approach and including positive sessions and body image therapies of the positive psychological approach, the client will be able to achieve the second goal in doable steps. The well-being survey will be conducted in order to gain more insight into the client's well-being and keep track of how effective the intervention is. Finally, creative arts therapy and again family-based therapy are used to reach the third goal of reducing exercise and finding new activities. Next to CAT and FBT, reading is included from week 4 on, as this is also one of the hobbies which he can spend time on instead of exercising. The treatment plan just described will hopefully help Cathy to increase her well-being again. Thank you for listening, and I hope you enjoyed our presentation.